Hi, I'm Dr. Kafali. Again, I'm here to answer your questions. And today's episode for Asking for a Friend question is, how long is laser or surgical vaginal tightening last? As we speak and as we gave the information previously, there are two types of approach for vaginal tightening, either with laser or surgical. Laser vaginal tightening is just for little need. You want the vaginal tightening, but you do not really need that major change. And you want a little bit of change at the same time. You want to have a little bit good amount of personal vaginal lubrication. We may also increase the urethral angle, and then you can stop having those stress urinary incontinence. And the laser is the way you think, it's not permanent. You have to have some maintenance laser treatment. The first laser treatment that you are going to be having three different interval. First treatment, 6 weeks later, another one, 6 weeks later, another one. And this first treatment, of course, it's not forever. So some of the patients want the maintenance laser treatment 8 months later, some of them 10, some of them 12. You as a patient are going to be the one making the decision when you really need to repeat that upcoming maintenance laser treatment. If you really see the difference in the stress urinary incontinence, some of our patients even come for 6 months after the surgery. So the take-home point about this, laser treatment for vaginal tightening is not permanent and it needs some maintenance. Surgical approach for vaginal tightening, you can definitely see drastic changes. It's not just going to be you feeling the difference, but your partner will definitely feel the difference as well. And this is a permanent change. It is not going to be needing a maintenance. But as an example, if you have a facelift, it is going to definitely take the edges off of your face. But again, it is not eternal, right? By aging, by getting old, collagen structure difference, genetic changes can also give the effect eventually on that facelift. It's the same thing. It is going to be permanent for what you have as a surgery, but aging can also show some changes over the years. And then eventually you may need laser treatment, or from that point eventually, whatever you want as a change, we can again offer you surgery, but mostly you will not need it. I can guarantee you mostly you will not need it. So laser needs maintenance treatment, but surgical approach, no, you will not need maintenance. It's gonna be a permanent procedure. And I hope this answer will be good for your question. And if you have any question or comments, please write it down on the comment below. And I will be talking to you again with your questions for a friend. Thank you. Bye-bye.